Let's move now to a major decision impacting millions of women all across the country. An FDA panel voting unanimously to recommend the first ever over-the-counter birth control pill, saying the benefits outweigh the risks. O-pill is a contraceptive that has no age restrictions and has been available for years just by prescription. Advocates say the change would significantly expand access, especially for young women. NBC News medical contributor Dr. Natalie Azar joins us now. We knew that there was going to be some kind of a decision yesterday, but what went into it? What was the thought process?
Well, remember, going into it, the FDA was basically asked to weigh in on whether they thought that a woman could safely and effectively take this oral contraceptive over the counter without the assistance of a healthcare provider, and also whether or not that woman would be able to self-identify herself as someone who may not be a candidate for taking this medication. And after a thorough, review of the data, they basically came to the conclusion that the risk of harm was far, far less than the potential for benefit in reducing unintended pregnancies, improving reproductive autonomy, and really expanding access, and particularly to marginalized communities. There is this thing that we have about 19 million women in this country who live in areas that are called contraceptive deserts, where there is just very, very little access to reproductive, care and health clinics and providers who can provide this kind of reproductive care.
So the advisory board says yes. Then what happens, and how soon might this be available upon final approval?
Right. So the presumption is that when the FDA makes its final decision over the summer, that they will follow the advisory committee's recommendations. It's not a foregone conclusion, but we're assuming, given that it was a unanimous vote, that the FDA will likely sign off on it. After that, we can expect it to be on store shelves probably in short order, but that's the way it's going to go. In terms of cost, we don't know exactly yet. It needs to be priced equitably. The majority of states in this country don't mandate that over-the-counter medications are covered by insurance, so we'll see. There's no point in having it on store shelves if people can't afford it. So, the drug company has also said that they'd like to provide consumer assistance, so fingers crossed it will be something that most women can afford.
Okay. All right, Dr. Azar, thank you.
You bet.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.